Welcome to a special edition of Cape. Today we have two very special guests with us. Trust me on this one. Now, seen is Barbara McCarthy. She is with the Rockport Board of Health. And then on Barbara's phone right nearby is Ruth George of the Rockport Board of Selectmen. Thanks for joining us, ladies.
Thank you.
Thank you for having us.
So right off the bat, Ruth, could you just tell us a little bit about the latest efforts with Rockport's vaccination program?
Okay, well, we're trying to get out as many vaccines as we can. So far, we have been given 200 vaccines by the state, and we have done senior housing, people over 75. That includes Pigeon Cove Ledges, Rockport High School Apartments, and Millbrook Park. That's approximately 60 residents. And then we've had two successful clinics at the community house with patients, with people 75 years older and in phase one. We did 120 the first clinic, and then did 4 homebound patients, and then did 100 just the other day, and did 3 homebound patients. And yesterday, Sandy Akers and I did 20 homebound patients. We're anxiously awaiting more vaccine from the state. We're using the community house as our area to do the vaccinations. It's going very well. We've done great with volunteers. We have 3 volunteer nurses, multiple people volunteering to observe the observation area. And it's going well so far.
That's so exciting, Ruth, to hear that you're actually doing homebound patients, because I've been reading that that's a real problem.
Yeah, we have used Diane Bertolino from the Council on Aging, and she has called to all different kinds of seniors. And I think we have about 60 or so people on the list. And now we've done probably 30 or so and gotten them off the list. They've at least gotten their first shot, and we'll be visiting them again with their second shot. So
you know, what's really helped us is that, you know, we've got that list of homebound patients. And as we're running our clinics, if folks don't show up or they're ill and can't get there, we then have folks left on the list that we can go and visit in their homes, so that we never have an unused vaccine dose. That's really, you know, that's been our overall ultimate goal. If you give us 100, we want to use 100 because there's definitely folks that can use those. So that's been a really great opportunity and a great thing that we've done.
And what is the level of caution that you're seeing in Rockport for receiving the vaccine?
You know what? I don't think we are seeing a level of caution. I think folks have been grateful. I've heard a few folks say to me, oh, I finally can exhale. I feel like I've been just holding my breath, staying in the house, being really cautious and careful. And now I can finally take a deep breath. Those are folks, though, that we do caution them to say, you know, this isn't, you know, a be all to end all. Even though you're vaccinated, we want you to make sure that you still wear your mask, that you avoid large gatherings, that you keep your social distance, and that you do hand washing. It is a brand new vaccine. So we're all learning as we go along nationally to make sure we know how this vaccine is, how effective it is, how durable it is, and what the precautions are as well.
I think we might have Ruth here with us.
In theory.
Yeah.
Yes.
Oh yeah, we got it though. We can match the voice with it. I love it.
Great.
Yeah.
Bob, have you had to deal with any adverse reactions from patients yet?
No, we haven't. You know, it's interesting, the adverse reactions, we keep folks for 15 minutes, again, because it's a new vaccine. We want to make sure they don't have an immediate reaction. The second dose, we may see a few more impacts just because your immune system is revving up as you get that second dose. We also have seen some folks that have pretty severe allergies. And if they already carry an EpiPen, or if they have a severe allergy, we make them wait for 30 minutes after they've received this vaccine.
But you still haven't
And we do the same for the homebound patients. We stay with them for 15 minutes or 30 minutes, whatever the case may be, to make sure that they're safe.
What's really great is that we have folks that Ruthie and I have worked with at Addison Gilbert for many, many years. And they're retired nurses, and they've been our observation folks. So they've got great clinical skills. They know a lot of folks around town, and they've been a huge help in our public clinics to be able to do the observation. They have great skills and technique.
And do we have this program in Rockport because it had been considered a red zone? Was this set up in response to that?
No, I think the Board of Health and the town really wanted to get into the vaccine program as fast as we could. I don't think it hurt that we were a red zone and they saw us as a great need to start getting the vaccines. But, you know, I think we're doing great as whatever we can get, we want to give. And
So
we want to make it as easy as possible for everyone to sign up. The biggest thing we need to remind people is they need to sign up for Code Red so that they get in the system so that they hear all the alerts of when we are going to have a clinic. And Mitch has been wonderful about putting Code Reds out to specific age groups, 75 and older, reminding them of a clinic coming up. We have open spots, please call. If you can't use your computer or don't feel comfortable, you can certainly call the main number for Town Hall, 546-5000, and ask to, speak to the for COVID line, leave your name and number, and someone will call you back and sign you up that way. So you don't even have to sign up yourself. We have people who will sign you up for a clinic and a time. So we're trying to make it as easy as possible for everyone.
That's
I
great.
think what's also unique about this is that, is that this is not a competitive sport. Okay. And I think that there are lots of choices for people to get vaccine. There's lots of places, whether they be the mass vaccination sites or the VA clinic or community-based clinics, or now we're hearing that pharmacies will be getting some vaccine. This is not wanting to stay, it's, wherever you can get the vaccine first. None of us are affronted if you get it somewhere and not get it in town. We want you to get vaccinated. That's absolutely the first thing. So again, we want to make sure people don't feel badly if they go down to Ferncroft, down to Doubletree, and don't use our clinic. Just get vaccinated.
Well, I think it's such a good point you make that it's not a competitive sport, because I think the lack of there's been such confusing messaging, and the lack of vaccine has made it almost feel that way.
Mm-hmm.
So I'm really glad you're pointing that out.
Yes.
Yeah.
Kudos
we
to
do
the
wanna-
town
We
of
work
Rockport.
with our local partners. We work with, we work with the Board of Health in Gloucester and Karen Carroll and her group all the time. And I'm the Addison Gilbert representative to the Incident Command in Gloucester as well. So we're back and forth having conversations as much as we can with other boards of health, and we exchange information and ideas and make sure that we got everyone covered that needs to be.
And we always are looking for volunteers to sign up with the MRC, the Mass Reserve Corps, of people to sign up, whether they want to be a nurse, an observer, or any way they could help. And just going through that program, we've got a long list of Rockport residents who've already signed up that we'll, use as our clinics get bigger, if we can get more vaccine and everything. So we have lots of Rockport residents who've reached out and volunteered for the town.
So do we anticipate more doses coming into Rockport?
Well, it's funny you should bring that up. Just before we got on this call with you, we received a communication from the Department of Public Health that is brand new, so we still have some questions about it, that said that the age groups and the phases are moving down to 65 years old and plus, 65 plus, with comorbidities and homebound patients and issues. But there's a but to this, that they will not be distributing vaccine to, or allocating vaccine to individual communities. They want you to develop regional partnerships. So I think they're looking at the best way to distribute vaccine from the state level down to individual locations to best use it, not waste it, and conserve their resources as well as ours. So we haven't really had time to explore that yet. Again, it's hot off the press news, and probably hasn't even been on Channel 5, 4, or 7 yet at this point. And there's a conference call on the 19th that we'll get more information about what that will look like. So more to follow on that, but the age groups are changing effective tomorrow.
Yeah.
So I have a question. If you have received the Pfizer vaccine, you have to receive your second dose, and the same with the Moderna. So if you
Yes.
receive that in Rockport and there is not a second clinic, can you go anywhere to receive your second dose?
They're going to honor all the people who've gotten their first dose in their local communities. All of those people, it looks like from what we just received, those first dose people will still, the towns and wherever you got it will still honor that, and you'll be getting your second dose wherever you got your first.
Okay, good to know. Good to
But to
know.
answer your question, Heather, you can, as long as you get Moderna, you can get Moderna. So, so say you're traveling and you got your first dose in Rockport, you can get Moderna second dose wherever. It's
Oh,
going to be
okay.
a different lot number, but that's okay. We write the lot number on your vaccine passport or your little vaccine card that we give you. And you just don't want to mix Pfizer, J&J, and Moderna. That's what you don't want to do.
Okay. All right. Well, uh, thank you to the town of Rockport for getting this program going. You guys have done a great job, I think.
Yeah, well, we wanted to make sure we got it out to the citizens because, we have such an older population in town, and they don't want to travel. It's, we've heard stories of doing our clinics when someone else had said, "Oh, my mother went way out to Gillette Stadium the other day to get her shot." Gosh, we don't want people to have to go way out there if they don't have to. We want to do it locally as quickly as we can. And if we have to do it regionally, we'll do it with Rockport, Gloucester, Essex, Manchester, Ipswich. We'll try to work with them and help with clinics there. But we want to get our residents vaccinated as soon as possible, everyone.
I think we do a weekly debriefing after our clinics.
Yeah.
And we do that for a reason. We want to make sure that as the numbers are small at this point, we've given 200 doses over the last couple of weeks. We want to make sure that as vaccine availability becomes more rampant and available, that we are able to scale up our operations to accommodate that. So we talk about, okay, this workflow, this pace, the number of people we have, the locations, this works for 20 doses, 60 doses, 100 doses. What if we had 1,000? What if we had 2,000? How would we do this? Would it look more like a drive-through than it does an inside clinic? What do we do about weather? So we have those sorts of discussions so that we're able to, when we get vaccine, we're able to scale up our operations. And we have names of people in queue that we could call to be able to help join our volunteer efforts as well.
That's great.
And our thought was to go forward when we got bigger, is to try to do a drive-through just like we did with the flu vaccine at the high school or the testing at the high school. Just do it all outside with good weather and have a staging area for people for waiting and use a lot of the MRC to help us. So I'm not sure if that's going to come to fruition, but that was our long-range plan.
I think what's interesting is that, Sandy Akers, who's done the vaccines, the jabbers, we call us, Ruthie, Sandy and I, we do the jabbing at this point. There's lots of folks behind the scene. Giving the injection is the easy part, okay? The behind the scenes folks are huge. From Mitch and Kelsey and Leslie in the office at the Board of Health, and the health department and town hall, to the folks at DPW who help us with traffic and getting room set up, to Diane Bertolino, who Ruth has mentioned, to all of our volunteers. There really is a housing, senior housing managers. All those folks really are the behind the scenes folks that, we couldn't do it without them. We might be the front facing people today, but we're certainly not the only people that are out there making this project successful.
Yeah. And we have the police blocking off the road, helping people get in and parking, and it really is a town-wide effort to get this going. And the Board of Health, all the work they've done to approve all of this, it's been great. It's been a real team effort, as Barb said.
Yeah,
what's also interesting is that I think this year more than ever, over the last year, we've had this great collaboration between the Board of Health, the Board of Selectmen, and the school committee. I think there are three legs of a stool that are all dealing with the same issues, whether it be testing, whether it will be regulation, implementation of regulation, of clinical protocols, of making sure that parents and citizens and teachers and staff are all on the same page and are giving the same message. So I think it really has been a great partnership between those top three groups of town leadership. We're supporting each other and bring different sort of subject matter expertise to the table. That's been helpful for everyone.
Actually, while we have you here, do you want to comment on the school, the testing, the COVID testing in the schools that's starting in Rockport?
You know, I'm not sure we're the right people to do that.
That's okay. That's
But
okay.
I do think that we've got a couple of weeks under our belt. So coming soon, I think it would be a great program for you to do next stop with them, because I don't know all the latest details and I would hate to misspeak.
Right. We'll grab Rob Lebo. We love talking to him.
Yeah. And
Now,
Jen Johnson. Jen's
Yeah.
done a great job as one of the school nurses to head this up.
with the current state program, are chaperones still eligible for the vaccination too?
Right now, it really is at the mega sites. They want the chaperone, they want those people to come in, and they want them to pre-register so that they know they're coming. We were planning on our next ones having a big sandwich board out front of the clinic saying who was eligible and having that very clear up front. If you haven't registered and you're a caregiver, you need to pre-register. We only have so many doses of vaccine, and it became very a little contentious out front the other day when people were coming in saying, well, I think I'll come with that person because they'd heard it on the news. But it really was very vague when Governor Baker put it out about the caregivers coming with people, because pretty much our doses, unless we don't have a full clinic, are all assigned a time, and we have all those doses taken care of. And then we try to do, like Barbara said, those few doses, maybe 3 to 5, go on our homebound list and go out with a little first aid kit and do those that day, because it's very time sensitive. We have to draw everything up, and it's only good for 6 hours. So, and it kept cool. So,
you know what I think has been a very interesting sort of byproduct of this that none of us really had thought about. We talking to the nurses that were in the observation room, the socialization that occurred in that room as people were 6 feet apart. They had seen people they hadn't seen in a year. And the conversations that happened, the sort of the mental health benefits of this. And as Ruthie, Sandy, and I went out and did home visits, that 15 minutes of observation was a great catch up with people, you know, that really hadn't seen a lot of folks in a year.
You're going to make me cry. I've seen so few people. I'm like,
yes,
oh,
I know. I know. It was really, it was a side effect and a side benefit of doing this that we hadn't even anticipated until we heard it from the folks in the observation room.
And it really is. I mean, everyone who's working the clinic, whether it's the front door people, like Barbara said, the observation people, Barb, Sandy, and I giving the shots, or us going to the homes, we're all local. We all grew up here. Everyone knows us. And it's like a time to catch up. And they were just thankful. I mean, I don't know how many people wanted prayers and give you this or give you that. Thank you. I couldn't believe I got on the list. And just so thankful to get their shot in town locally, especially for the homebound coming to their home.
You know, and we're really fortunate that we're able to have folks call the health department and get registered. When you think about the folks that we're trying to do in this early phase, you know, they're not electronically connected with cell phones and computers and passwords and registration and double click this and triple click that. That's just not their skill set. So having folks help them and being able to call and get registered and come in was a huge benefit for the residents in this age group.
Right. And we had multiple people, people who were secretaries at town hall who weren't coming in yet, or other people, Paul Murphy and Mary Beth Murphy, several different people signed up and said, call me with different people's names and numbers. I'll call them and get them in to Prep Mod and get them a time. And that for a clinic. So we had multiple people offering to get people in and signed up, which was another great help.
Mhm.
Shows what a great town unity this thing is, and it's brought to the town. It's really brought everyone together.
Right, like Bruce Cohen, the chair of our Board of Health, him and his wife were registering folks and greeting folks as they came into the clinic the other day. So, you know, everybody's just sort of pitched in and done what they could do to help. It's really been a community-wide effort.
Yeah, all
Well
hands on
said.
deck.
It's a great
Well said.
story and it's a great town. Thank you very much.
Yeah.
Oh, you're very welcome.